The TED Talk that I decided to do was the quest for a coronavirus vaccine. The speaker that they interviewed with was Dr. Seth Berkley. Dr. Seth Berkley is CEO of a company called Gavi, and he's been the CEO since 2011. He's a world-renowned epidemiologist, a Harvard graduate, has been trained by the CDC, and he's a very big advocate of promoting vaccinations in third world countries and rural areas. Very big proponent of prevention rather than treatment. So today, how we make our vaccines are we take a little bit of whatever the disease is. We usually don't use the live viruses as much as we used to. We still do occasionally, but it's created in the lab, it's replicated in the lab. Take a very small part of that and they introduce it into your system. Sometimes by nasal spray, but typically it's done by an intramuscular injection. What that does is it triggers an immune response. So your body will recognize it and try to fight it. Usually you don't get too sick, but sometimes you do, and that's why you hear people say, I won't get the flu vaccine because I got the flu last time. Well, what it does is it kind of weakens your immune system while your immune system is fighting this new foreign substance that's been introduced. So it essentially, it does weaken your immune system, but it's to build it up later. So the hope is that whenever this foreign disease, whether it's the flu or smallpox or whatever, is introduced, your body can fight it off. There's a lot more people are vaccinated against the older diseases, and I say that because they're vaccines that have been around forever. Like I said, smallpox, measles, chickenpox has even had a vaccine out for many years now. The newer ones, like the flu changes every year, you have the HPV vaccine, people are a little more wary of that. And it's just because we are so advanced with our vaccines that a lot of people today don't even realize how bad it can be. Like, we have never had to worry about giving birth to a child that may have polio. And we essentially are very privileged in that way. So we say, hey, those side effects are too much. So they'll opt to not have side effects and risk their child getting a deathly illness because they've never seen it and never had to worry about it. As far as the Ebola vaccine, the reason I'm comparing that with the coronavirus is because it's one of our newest vaccines. It's not regularly given. So the Ebola vaccine they started to create a vaccine after 9/11. They had a list of potentially diseases that could potentially be used in bioterrorism. Ebola was in that list. So they started working on all these vaccines, and then they decided, I don't know who and at what point, decided that Ebola wasn't going to be a threat for bioterrorism. So they put it up on some shelf in some science lab. Well, fast forward to a few years ago when they had the Ebola outbreak, now we need a vaccine. Well, there's one already half created. So they were able to roll that out so quickly because half the work was already done. And now people are saying, well, if the Ebola vaccine came out that quickly, why can't we get a coronavirus vaccine that quickly? And that's just the simple answer is one was already in the works. And unfortunately, we have not had a coronavirus outbreak before this. I mean, I say unfortunately, fortunately, but unfortunately, because we don't have any started. So vaccine creation today, pharmacology is a huge part in it, but they are essentially a for-profit business. So it takes billions to trillions of dollars of the science and the methods to create a vaccine. It's very expensive to create, but once you get it, they're usually very cheap to produce. So it's just that initial money that needs fronted. They can do certain things for charity, but usually it's very short-lived because they do need to get money. Like I said, essentially it is a business. And then there's CEPI, which is a really good group. It stands for the Coalition of Epidemic Preparedness and Innovation. And what these guys do is they make vaccines for diseases that have the potential to become epidemics. They are not funded enough, really. Now, getting into the coronavirus. So the information is literally changing daily, if not sooner, on what we are learning about it and what we know. So much is still speculation. But the coronavirus itself has over 30,000 isolated strains. It does come from animals, primarily they are bats. It gets its name because the virus has these spikes that will attach to the receptors in your lung, and those spikes make it look like the sun, and corona means sun. This is not the first strain. COVID-19 is not the first strain to cross over from animal to humans. The SARS outbreak and MERS from several years ago are two of the most widely known. Also, two viruses that also come from coronavirus are HIV and the common cold. So there's no immunity when you get the common cold. We know that. We get that every single year. It doesn't matter. You can get it 3, 4, 5 times in a season. So there's really no evidence at this point to say that with the coronavirus, we are going to develop immunity. The hope is that we will, but we just don't know, and it's not something we can count on. The flu versus the coronavirus. So there is a flu vaccine, obviously. The reason we have to get the flu vaccine every year is because that strain mutates constantly. So it never stays the same. So our vaccines can't stay the same. So we always have to be tweaking and trying to predict what strains are going to be the most prominent that season. The coronavirus hasn't really mutated yet that what we've seen, but what it does is it weakens the immune response every time a person's infected. Now, once again, we haven't seen a lot of reinfection rate. I know the last thing that I had seen, China had like a 10 or 14% reinfection where people had it, tested positive, treated it, tested it again, and it was negative, and then they became sick again and got it again. About 14% was the last number I personally have seen. So it is possible to reinfect. But is it going to be easier every time because the immune system, the immune response is weakened? We just are not sure. Hopefully, we'll be able to create a vaccine and be able to put a stop to that. A lot of people are talking about herd immunity as well. The herd immunity, we talk about it more with the older vaccines, like the polio and stuff, for those who cannot get vaccinated. But true herd immunity only comes with long-term immunity, like those old vaccines. Right now, there's just too much unknown about the coronavirus to know if that's something that is going to be plausible someday. So creating this vaccine, currently there's 40 different companies that say that they have a candidate vaccine. And what that means is that they have a computer-generated genetic sequence that they can run a simulation and say that, yes, I think this vaccine will work. It's not been tested. There's several steps in a typical vaccine creation. So first you usually have your preclinical research, animal testing, human studies in the healthy, human studies for those at risk, like for coronavirus, it would be the elderly and those with lung issues, and the efficacy. That all usually takes 10 to 15 years. This is why it's so important that we need to have companies working on prevention rather than scrambling when there's an outbreak like this. So when we have an outbreak, those steps do not have to be sequential. We typically reduce, we will cut out the animal testing. We have volunteers who are totally invaluable. They step up, they sign a full disclosure, full consent. They understand what they're signing up for, that they could get very, very sick. They could even die from it, but it's all in the name of science and trying to get a vaccine out faster. So even with all of that, the current timeline outlook is 18 months until we can get a COVID-19 vaccine. That is 18 months of social distancing and quarantining. We are in a position right now that people aren't listening. They are not social distancing, and states are having to essentially declare martial law to try to keep people at home and keep this from spreading. So, and economy-wise, are we going to be able to sustain that? We just don't know. And it's one of those balances of economy and health. So a question that was brought up in the TED Talk was, we are isolating ourselves, those of us who are. Is that going to make us weaker when we are exposed to it? It's kind of like if you wash your hands too much, you take away all the good bacteria, those kinds of things. It could, but the answer is right now, our priority is we need to be stopping that chain of transmission. So it doesn't matter what it's going to do to us later. If we don't get it under control now, that needs to be our very first step. When a vaccine is created, they may need different strengths for different at-risk groups, like the elderly. They may need something stronger than what your average person will. So to get back to normal life, how we need to do is we take our controls, which are our people who have recovered, and slowly let them start living their life again. China's in the process of doing this now. The key is you can't rush this. If you do it too quickly, then there is a possibility that you could start this whole pandemic all over again. So it's essential that it goes slowly and you really follow those people and monitor them. They're also doing antibody testing. Once again, not really sure if immunity is something we're ever going to get from this, but there are some studies that suggest that a natural immunity may be plausible. The possibility for getting a vaccine, there is always a possibility that we can never have one. HIV and the common cold are two very good examples of viruses coming from coronavirus that we've never gotten a vaccine for. HIV has a few that are in the works, but the problem with that is it is continually morphing. It is mutating. So since the coronavirus, this COVID-19, is not continually doing that, there is a possibility, I'd say a greater possibility, that we will be able to create a vaccine. So in order to prevent, the big thing is we need to focus on prevention is better than treatment. So we need to get that vaccine out. We need to get those treatments out so we can get ahead of this instead of trying to play catch up. A lot of problem is worth sinking so much time and money into this right now. But if it were to die on its own, would we continue to? Probably not, because that's usually what happens. It gets under control by other means and we just kind of forget about it. We need to stop doing that. We need to make these things a priority, because there is a possibility that this may reoccur every year, just like the flu. And we do not want to go through this again in another year, 2 years, 3 years. We never want to go through this again. There are other interventions that are being tested besides the vaccine. like I talked about the recovered patients, they're doing some blood tests to look at the serum. Best case scenario with all this is it could taper with social distancing, but no matter what, we still need a vaccine. So in the US right now, I know everybody's heard about it. There is such a shortage with masks and all kinds of PPE. We are only giving them to the healthcare professionals. And even then, I can tell you that it is being very closely monitored. We are reusing when we have to, which is pretty much all the time. It's not something that's recommended any other time, but we really have our backs to a corner right now. In China, everybody walking on the street is wearing a mask. This is not something that is necessarily recommended. Really what they're doing is the mask is a reminder not to touch your face, because touching your face, your mouth, your eyes, nose, whatever, are good ways for that virus to transmit. So it's really just a hard stop to try to keep you from touching your face and essentially getting that. My 3 questions that I took from this were, 1, do you think we're ever going to develop immunity from the coronavirus after getting it? Personally, I think it's probably pretty low. If we do, I don't think it'll be full immunity. I think it'll be partial. What will happen if it takes 18 months or longer to get a vaccine? And what if no other alternative happens? That's probably the most frightening thing to think about. Even if it does take 18 months and we have an end in sight, that's still very, very long. It's a long time for our economy, for our mental sanity, for us, just the way we're living, to continue to do this. It would be very stressful for sure. So I'm really hoping that somebody out there gets this under control and is able to get this settled much sooner than 18 months. My 3rd question is, do you think it should be mandatory to get other vaccines? Those anti-vaxxers today who are so big on not getting the ones that are tried and true, and not vaccinating their children. When I went to school, you had to have your vaccines in order to start kindergarten. Today, apparently, it's not a thing anymore. Like, you don't have to send your kid to school. So, but we have a pandemic like this, that child is, if they get sick, they're opening a whole slew of diseases that are preventable. So I personally think it should absolutely be mandatory unless there are health reasons. And by health reasons, I mean you're getting cancer treatments, or there's some kind of actual legitimate reason, not just, oh, they got a fever last time, or oh, this happened or that happened. It needs to be something that's very life-threatening, because these diseases are life-threatening, and if we don't start treating them as such, this is going to be the first of many outbreaks.